Hello, future nurses. Welcome back to another power-packed NCLEX prep session. Every single day in this series, we'll dive into 2 to 3 high-yield topics with practice MCQs designed not only to test your knowledge, but also to train your exam strategy. If you stay with us daily for the next 30 days, I can confidently say you'll be fully prepared to pass the NCLEX on your very first try. One concept at a time, step by step, we'll simplify even the toughest topics and connect them to real nursing practice. But before we move into today's lesson, let me share something big with you. We've just launched our complete NCLEX review crash course that has already helped over 10,000 students clear their NCLEX on the very first attempt. And now, it's your turn. When you enroll, you'll unlock live daily classes with expert guidance, 500+ hours of recorded lectures you can rewatch anytime, 100+ hours of animated crash lessons that make tough topics super simple, 5,000 NCLEX-style and previously asked questions, 30 practice tests in real NCLEX exam format, next-gen NCLEX questions, practice pack, detailed lectures plus PDF notes plus complete NCLEX ebook, and much more, all in one place. The best part, right now, we're offering a massive 70% discount on the total course fee, but only for a very limited time. Click the WhatsApp link in the description box to grab your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. Now, let's jump straight into today's topic, pain. Pain is not only the most common reason patients seek medical care, but it also directly affects comfort, recovery, and safety. The very first thing you must remember is that pain is defined as whatever the person experiencing it says it is, and it exists whenever the person says it does. This tells us that pain is always subjective, and only the patient can truly describe it. As nurses, our responsibility is to assess, believe, and respond to that report rather than judge by appearance. Moving forward, let us understand the physiology of pain. Pain follows a pathway with 4 important steps. It begins with transduction, where noxious stimuli like injury, inflammation, or ischemia activate nociceptors. The next stage is transmission, where impulses travel along A delta fibers, producing sharp pain, and C fibers, producing dull, aching pain, to reach the spinal cord and brain. Then comes perception, where the brain actually interprets the pain signal and makes the person consciously aware of it. Finally, we have modulation, where the body releases natural opioids such as endorphins and serotonin to dampen the sensation of pain. A quick NCLEX reminder here is that perception in the brain is where pain becomes conscious, so if you ever see that in a question, you will know the answer. Now, let us explore the types of pain, since this is another high-yield concept. Acute pain is short in duration, often caused by injury or surgery, and it activates the sympathetic nervous system. In contrast, chronic pain lasts longer than 3 to 6 months and is often linked to conditions like arthritis, cancer, or neuropathy. Somatic pain comes from skin, muscles, or joints and is sharp and localized, while visceral pain arises from internal organs and is dull, crampy, and poorly localized. Neuropathic pain results from nerve damage and is described as burning, shooting, or electric-like. Here is an NCLEX pearl. Neuropathic pain does not usually respond well to opioids, and instead, it requires adjuvant medications like anticonvulsants, such as gabapentin or antidepressants. Next, let us move into pain assessment, which is a cornerstone of nursing care. The gold standard for pain assessment is always the patient's self-report. Tools that help include the numeric rating scale from 0 to 10, the Wong-Baker FACES scale used for children or patients with language barriers, and the FLACC scale for infants and nonverbal patients, which looks at face, legs, activity, cry, and consolability. In every assessment, you should gather the location, intensity, duration, quality, and factors that aggravate or relieve the pain. On the NCLEX, remember that even if a patient looks comfortable but says they have pain, you must believe their words, not their appearance. From here, let us focus on interventions. Pain management involves both pharmacological and non-pharmacological strategies. Pharmacological measures include non-opioids like acetaminophen and NSAIDs for mild to moderate pain, opioids like morphine, hydromorphone, or fentanyl for severe pain, and adjuvant drugs such as antidepressants, anticonvulsants, and corticosteroids. Non-pharmacological interventions are equally important and can include relaxation, deep breathing, guided imagery, distraction, heat or cold therapy, repositioning, massage, music therapy, and even spiritual support. Combining these approaches provides the best relief. When opioids are used, nursing considerations become critical. Always monitor for respiratory depression, as a rate below 12 breaths per minute is dangerous. Be alert for constipation, nausea, and sedation, and always have naloxone available as an antidote. The nurse should titrate the opioid dose to achieve comfort with the fewest side effects. A must-know NCLEX tip is that if a patient's respiratory rate drops to 8 after receiving morphine, the immediate action is to stop the drug and administer naloxone. Now, let us take a moment to talk about special populations. Children may not express pain clearly, so tools like the FACES scale are valuable, and you should never assume they are exaggerating. Older adults may underreport their pain due to fear of addiction or a sense of stoicism, so careful assessment is vital. For post-operative patients, uncontrolled pain is not only uncomfortable, but can also delay healing and increase complications, making proper management essential. At this point, we should also remember the ethical and legal aspects of pain management. Pain relief is a fundamental patient right, and as nurses, we must advocate for adequate pain control. Withholding medication due to fear of addiction or judging a patient is considered negligence. Finally, let us highlight the NCLEX high yield points. Pain is always subjective, and self-report is the best indicator. Always assess before and after administering analgesics. When prioritizing patients, those with severe acute pain that impacts vital signs take precedence. Non-pharmacological interventions should be used together with medications, not in place of them when pain is severe. To summarize with a clinical pearl, the pain pathway follows transduction, transmission, perception, and modulation. The key types are acute, chronic, somatic, visceral, and neuropathic. The gold standard is the patient's self-report, and the most serious risk of opioids is respiratory depression. Always remember, you must treat the patient, not the number on the scale. And that brings us to the end of our lecture on pain. Always remember that pain is more than just a symptom. It is considered the fifth vital sign and must be treated with the same seriousness as any other clinical condition. By believing the patient, applying safe nursing interventions, and combining both medication and non-medication strategies, you can ensure effective and compassionate care. Before we move ahead, here's something exciting just for you. We've launched our complete NCLEX review crash course, which has already helped over 10,000 students pass the NCLEX on their first try. And now, it's your chance to join them. When you enroll, you'll unlock live daily classes with expert guidance, 500+ hours of recorded lectures you can revisit anytime, 100+ hours of animated crash lessons to make concepts crystal clear, 5,000 NCLEX-style and previously asked questions, 30 full-length practice tests in real NCLEX format, Next-Gen NCLEX Practice Pack, detailed lectures, PDF notes, and a complete NCLEX ebook, and much more, all in one powerful package. Best part? You can grab it right now at a 70% discount, but only for a very limited time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX success journey today. And don't forget, join our Telegram channel for extra free practice questions. The link is also in the description. Now that you know the fastest way to guarantee NCLEX success, let's jump straight into practice questions. Question 1. A patient after abdominal surgery reports severe pain rated as 9 out of 10, but the nurse notices the patient is lying still and does not appear distressed. What is the best nursing action? Options are A. Reassure the patient that their pain does not look severe. B. Administer the prescribed analgesic as requested. C. Delay giving medication and reassess in 1 hour. Or D. Encourage deep breathing instead of pain medication. The correct answer is option B. Administer the prescribed analgesic as requested. The rationale is that pain is always subjective, and the gold standard is the patient's self-report, not how they appear. Nurses must never underestimate or dismiss pain just because outward signs are absent. Question 2. A nurse is caring for a child with sickle cell crisis who complains of intense pain. What is the priority intervention? Options include A. Encourage distraction with television. B. Administer the prescribed opioid. C. Place the child in a Fowler's position. Or D. Apply ice packs to the affected joints. The correct answer is option B. Administer the prescribed opioid. Severe vaso-occlusive crisis pain is managed with opioids, not non-pharmacological methods alone. Distraction and comfort measures may be supportive, but effective pain relief requires medication. Question 4. A nurse is assessing a patient with diabetic neuropathy who describes pain as burning and shooting down the legs. Which class of medication would be most effective? Options are A. Opioids, B. Anticonvulsants, C. NSAIDs, or D. Antipyretics. The correct answer is option B. Anticonvulsants. Neuropathic pain is best treated with adjuvant drugs such as gabapentin or pregabalin, while opioids and NSAIDs are less effective in this type of pain. Question 5. An older adult reports chronic arthritis pain but refuses medication due to fear of addiction. What should the nurse do? Options include A. Respect the decision and withhold all interventions. B. Explain the difference between tolerance and addiction. C. Force the patient to take medication. Or D. Switch to only opioid therapy. The correct answer is option B. Explain the difference between tolerance and addiction. Nurses must educate that using analgesics for pain relief is not the same as substance abuse, and appropriate education can reduce unnecessary suffering. Question 6. A nurse uses the FLACC scale to assess pain. Which patient population is this tool best suited for? Options are A. Verbal school-aged children, B. Nonverbal infants and toddlers, C. Adults who can use a numeric scale, or D. Patients who exaggerate pain. The correct answer is option B. Nonverbal infants and toddlers. The FLACC tool evaluates pain based on face, legs, activity, cry, and consolability when the patient cannot self-report. Question 7. A patient describes abdominal pain as dull, crampy, and poorly localized. What type of pain is this? Options include A. Somatic, B. Neuropathic, C. Visceral, or D. Referred. The correct answer is option C. Visceral pain. Visceral pain originates from internal organs, is diffuse, and often crampy, while somatic pain is sharp and localized. Question 8. A nurse prepares to give acetaminophen to a patient with mild pain. Which nursing consideration is most important? Options are A. Monitor for renal impairment, B. Monitor for liver toxicity, C. Monitor for constipation, or D. Monitor for respiratory depression. The correct answer is option B. Monitor for liver toxicity. Acetaminophen is hepatotoxic in high doses, and total daily dose must not exceed 4 grams in adults. Question 9. A post-operative patient receiving opioids complains of constipation. What is the best nursing intervention? Options include A. Discontinue opioids immediately, B. Add a stool softener or laxative, C. Reduce fluid intake, or D. Encourage bed rest. The correct answer is option B. Add a stool softener or laxative. Opioid-induced constipation is a predictable side effect, and prophylactic bowel management is standard care. Question 10. A nurse is caring for multiple patients. Which patient should be given pain medication first? Options are A. A patient with chronic back pain rated 6 out of 10, B. A patient post-appendectomy with severe pain rated 9 out of 10, C. A patient with arthritis reporting mild stiffness, or D. A patient with cancer reporting intermittent pain rated 4 out of 10. The correct answer is option B. The post-appendectomy patient with severe acute pain. Acute post-surgical pain that is intense requires immediate priority intervention to maintain stability and prevent complications. Thank you.